Hi, my name is Vicky and I work as a midwife in the maternity unit. We are delighted to welcome you to our unit where we strive to offer high quality care to both you and your birthing partner that meets your individual needs and preferences. Here we have 2 admission rooms and 4 birthing rooms. The operating theatre is located on the first floor of the hospital. Before arrival to the unit, you may have rang ahead and spoken to a member of our midwifery team. We encourage you to do this where possible, as it allows us to provide reassurance and support and triage our admissions effectively. This is our admission room, where we will introduce ourselves and welcome you to our unit. Here we will carry out an assessment on both mum and baby. We perform an assessment of baby by carrying out a CTG monitoring for approximately 20 minutes and listen as you tell us why you have presented to our unit. Depending on this assessment and your preferences, you may be offered an internal vaginal examination to determine if you are in established labour. If you are in established labour, we will escort you to the birthing suite with your partner. If you are not in established labour, we will discuss your options to go home if you feel comfortable to do so and your pregnancy is low risk. Or you may be transferred out to our antenatal ward until your contractions are more established. The care we provide in our unit is woman-centred, and we will support you and your birthing partner to make informed decisions throughout your journey. We will discuss your birth preferences and support you to achieve these as much as possible. This is our birthing suite. Here we aim to recreate a home away from home environment using music and mood lighting to promote relaxation. Relaxation techniques in labour will help your body to produce endorphins, which promote the body's natural pain mechanism. If it is your wish, we will encourage you to remain as active as possible throughout your birth by using aids such as a birthing ball, peanut ball, birthing mats, birthing stool, delivery bed which facilitates different positions, and different labour positions promote optimal fetal positioning, hydrotherapy, labour hopscotch, TENS machine, and Entonox. We also have a 24-hour epidural service which is available in active labour upon your request. When you are admitted to the birthing suite, you will be assigned a designated midwife who will support you throughout your journey. Together with your birth partner, your midwife will provide emotional, physical and professional support to you. The level of support we provide will be on your terms, as every labour is individual and unique. We aim to build a trusting relationship with you and your partner to achieve the birth you desire safely. The level of monitoring throughout labour will be intermittent or continuous monitoring. Your pregnancy to date will determine the level of monitoring recommended. If for any reason your birthing journey results in the need for a caesarean section, you and your birth partner will be involved in the decision-making process. Your midwife and birth partner will accompany you on this journey.
Hello, my name is Natalia and I am going to discuss and explain what fetal monitoring is, why and how we do it. During your pregnancy, labour and birth, various assessments are carried out to ensure everything is progressing normally and your baby is not experiencing any difficulties. One such assessment is listening to the baby's heartbeat. Most babies go through pregnancy, labour and birth and are born without any problems. However, there are some babies who have difficulties, and the best way of finding out when a baby is experiencing difficulties is to listen to their heartbeat. You will be offered to have your baby's heartbeat monitored. known as fetal monitoring, during your pregnancy, labour and birth. Fetal monitoring can be done in two ways. Intermittent auscultation, listening for a short time at regular intervals with a Doppler or Pinard stethoscope. Continuous electronic fetal monitoring, EFM, known as continuous monitoring, using a cardiotocograph, CTG machine that draws a graph of your baby's heart rate and your surges or contractions. Intermittent auscultation is monitoring your baby's heartbeat by using a Pinard stethoscope or handheld Doppler. During your birth, the midwife will palpate your abdomen to feel for a contraction. They will listen to your baby's heartbeat for a full minute at the end of a surge or contraction. I'm going to just listen to your baby's heartbeat for a minute with Pinard. Is that okay? As labour progresses, your baby's heartbeat will be checked more often. In the first stage of labour, your baby's heartbeat will be monitored every 15 minutes and every 5 minutes in the second stage of labour. Your pulse will also be monitored at the same time to differentiate between your heart rate and your baby's heart rate. A cardiotocograph, CTG, carries out continuous fetal monitoring or electronic fetal monitoring. It produces a visual display and in some cases a paper recording of both the baby's heartbeat, the mother's heartbeat and any uterine activity. Two discs called transducers are placed on the abdomen with some gel. These are held in place with two elastic belts. Belts around here. One disc picks up the baby's heartbeat and the other disc picks up the frequency of the mother's uterine activity. Sounds like a happy baby. So this is the monitor to measure any uterine activity. So we put it here at the top of the uterus, okay? The machine produces a continuous graph of both of these referred to as the trace. The machine also produces a beating or pulsing sound that represents your baby's heartbeat. Your blood pressure, heart rate, temperature and oxygen levels will be all checked regularly throughout your pregnancy and birth. So I'll get you to put your finger in there. Yeah, and both numbers come up here, Vanessa. You may also be given a clicker to push every time you feel your baby move. Vanessa, this is a little monitor to measure your baby's movements. So every time you feel your baby move, can you click the top button there? Mobile CTG monitors are available to enable you to mobilise and change position while being monitored. If you're admitted to hospital with any issues after 26 weeks of pregnancy, a daily CTG will be recommended. If your pregnancy or birth is considered high risk for any reason, a CTG will be the recommended method of fetal monitoring during your baby's birth. A list of common reasons where continuous fetal monitoring is recommended can be found in your fetal monitoring leaflet. Your healthcare practitioner will discuss the recommended method of fetal monitoring with you. They will answer any questions you have, and your consent will be sought prior to carrying out any fetal monitoring.
Hello, my name is Sinead Thompson and I'm a community midwife at the National Maternity Hospital. I designed and created Labour Hopscotch in 2015 in response to an increase in the epidural rates and also in medical interventions during labour and birth. The principle of Labour Hopscotch is to encourage optimal fetal positioning. This means having your baby's head in the optimum position, lined up so it can descend into the pelvis in the optimum position for labour. When this happens, it triggers the spontaneous onset of labour. When women go into spontaneous labour, it's less likely that they'll need induction, and that means that there'll hopefully be less intervention in their births. The Labour Hopscotch framework aims to support and promote natural and active labour. It is encouraged for all women, regardless of the care pathway that they choose for their birth, but encourages more natural methods of pain relief where possible, for as long as possible in labour. Using the idea of the game hopscotch we all played years ago, each of the steps can be undertaken to remain active during labour. The process can start at home, beginning at the bottom of the hopscotch board when you're more active and mobile. The bottom square of the Labour Hopscotch is called the mobilised square, and it aims at promoting optimal fetal position. There are 4 activities associated with this step, and it's important that these 4 positions are practiced throughout the antenatal period in preparation for your labour. Your midwife will explain the positions to you during your pregnancy. Our research findings, which we published in 2019 in our research study, showed that women who practiced Labour Hopscotch had reduced epidural rates, reduced the caesarean section rates, increased spontaneous onset of labour and vaginal deliveries, and most of all, there was an increase in birth satisfaction rates. Having a positive birthing experience makes a smoother transition to parenthood.
I want to show you different movements and positions to support you in early labour. If your waters have broken or you have been advised by a healthcare professional to come into hospital when labour starts, these movements and positions can be utilised in the hospital setting. We advise that you remain at home for as long as you are comfortable to do so, or until your contractions are a regular 5 minutes apart and lasting 50 to 60 seconds. You count your contractions from the beginning of one contraction to the beginning of your next contraction. Please be mindful of your distance to the hospital, and you can phone the maternity unit at any time where the midwife will advise you. Moving around and changing positions in labour can help relieve pain, shorten the length of time of your labour and distract you from your contractions. Movement in labour makes sense. Your body is usually upright, which means gravity is helping to move your baby down your birth canal. Walking in labour will help to open up your pelvis. When you are standing, rocking or swaying your hips from side to side or in circles with feet and knees apart may help to relieve pain or tension in your muscles, and it may also help to speed up labour. Music and positive affirmations will also help. If your labour has slowed down, walking up and down the stairs can help speed it up. Sidestepping or lunges will open your pelvis at varying angles as you move up or down the stairs. This encourages your baby to move down into an optimum position for birth. When using a birthing ball, you can complete many different movements, including the figure of 8, hip circles, rotating back and forth, and the pelvic tilt. Gentle neck stretches and shoulder rolls will help to relieve muscle tension. The use of a TENS machine can also be beneficial at this stage. If you feel you need to rest, lie on your left side and place some pillows in between your legs. If you feel unwell, stop, take a break, and talk with a midwife. You could also try and rest in a warm, not too hot bath or sit backwards on a chair or toilet. Many women find the all fours position comfortable as it takes some of your baby's weight off your lower back and helps to relieve back pain in labour. It will also give your baby more room in your pelvis. Kneeling can be done on the ground using a yoga mat or pillow on the bed. The pelvic tilts can also be achieved in the all fours position. This is also a good opportunity for your partner to provide some physical support by gently rubbing your back or shoulders. Use your birthing partner to lean on for support in a standing or squatting position. They can emotionally support you in this way too. Supportive words and affirmations during your labour will stimulate the love hormone oxytocin. This will encourage your contractions and release endorphins, unnatural painkillers. The really important message for you is to keep moving and changing positions during labour, whether at home or in the hospital. Your birthing partner or midwife will be there to guide, support and offer suggestions to you.